Good evening. My name is Elizabeth Moy, Risk Management Consultant with Milmick Insurance Company. I'd like to welcome all of you to our presentation of Telehealth in the Age of COVID-19, Implementation, Engagement, and Security. We want to thank the Nassau County Medical Society for collaborating with Milmick in bringing this webinar to you. Today's presenters are Dr. Salvatore Volpi and William Hassett, Esquire. Dr. Volpi has over 30 years of primary care practice experience and is currently the Chief Medical Officer for the Staten Island Performing Provider System and former president of the Richmond County Medical Society. Dr. Volpi is a national lecturer on diverse topics such as consumer health software, electronic health records, the patient-centered medical home, physician-patient communication, and social determinants of health. Will Hassett is an attorney with Fager, Amsler, Keller, and Chapman, counsel to Milmick and its insureds. The program will provide participants with 1 hour of continuing medical education credits and will go from 6 to 7 p.m. At the end, there will be a question and answer session, and you can post your questions on the Q&A feature on your screen. Matthew Lamb, Assistant Vice President of Risk Management, will be monitoring those questions throughout the program. We ask that you please complete the CME evaluations that will be posted at the end of the program. Your CME certificates will be emailed to each of you within a month. I hereby state that Dr. Volpi nor William Hassett have any relevant financial interest in any portion of today's program. Today's program objectives. Could we move on to the slide for the program objectives?
Yes.
Okay. Okay, so upon completing this program, you should be able to describe the various types of telehealth that are available. Also, we will provide data on the value of the use of telehealth. There will be examples of provider workflows that will help you with the use of telehealth. You will recognize the roles of staff and how to have them buy into the use of this technology. And also, they will be addressing barriers to the use of telehealth. I will turn the program over to Dr. Volpi.
Thank you, Elizabeth. Good evening, everyone. We'll also be talking about the security risks presented by the expansion of telehealth, review the Hipaa security rule in telehealth, as well as strategies to reduce the risks of a privacy breach or a cyber attack while using telehealth. Talk about there are two major types of telehealth. Everyone who's been in practice, believe it or not, has already been practicing telehealth, probably since they were a resident. And that is just picking up the phone and talking to a patient. That is the simplest and most basic form of telehealth, and it's synchronous. I say something and they say something back. More advanced includes a video like we're doing now with this Zoom call. Asynchronous types of telehealth have to do with what's called taking an image or taking information, sending it for review at some point in the future. So this could happen either a patient who has a relationship with a dermatologist might have permission to take images and securely submit them to the dermatologist for evaluation. You could also have primary care physicians taking images in their offices and again securely transferring it to a dermatologist for review. There's also remote monitoring. As more and more care is rendered in the home, there are machines that can monitor blood pressure, weight, ECGs, pulse oximetry, etc. And again, asynchronous means it's not meant to be seen immediately, but eventually. It's very important to address the issue of PCMH. PCMH is patient-centered medical home care. It's been very popular in the past 10 to 12 years, becoming more popular. More insurance companies are expecting it from primary care doctors. However, you should also know that many specialists can also participate in a patient-centered medical care model and also get enhanced reimbursement. And the idea in patient-centered medical care is for the physician or the main caregiver to have access to lots of information. So you need health information technology to be exchanged. You have to provide after-hours care, and telemedicine makes it a lot easier to provide after-hours care. Just so you know, PCMH also seems to lead to an increase in office visits. Now, that means you're providing quality office visits. These are not just churning visits, but visits that have value to the patient. And what happens is, as the patients come to the office, they are less likely to feel the need to go either to an urgent care or to an emergency room because they know they have access to you. But again, this study was before telemedicine became more prevalent. So you can just assume that when we say visits, they're not necessarily in-office visits. It's also telehealth visits. Something else that's very important to note is that when patients are involved in a PCMH model, they tend to be happier. And that's because they're getting the attention they deserve. And what you need to know is that there are surveys that go out to patients asking about their care. And in general, most patients love their docs. You should know that. But when it comes time to getting reimbursed from the insurance companies in a value-based payment model, quality of care, the perceived quality of care has a lot of importance. So how could you use telemedicine? Well, telemedicine is almost A to Z. In this case, it's A to U. So the classic stuff which does not require some sort of physical hands-on intervention. So if someone's complaining about their allergies, maybe it's an asthma follow-up, maybe some minor sinus issues, some arthritic pain that you're familiar with, a cold or bronchitis. Obviously, you can't do a rapid flu test, but maybe a follow-up to the flu that was diagnosed in your office. Mild diarrhea, obviously not something that leads to significant dehydration. And again, infections, pink eye, these are lots of things that could be done either verbally or again, face-to-face with the patient, or again, the cell phones are so good that again, assuming that you're transmitting this data securely, you could take a picture of someone's pink eye and have an assessment there. It's also very important in chronic care. Again, most HMO type patients see their doctor about 3.5 times per year, and those tend to be for acute visits. But there's an opportunity to interact with the patient more frequently and effectively and efficiently through telehealth to manage their asthma, congestive heart failure, etc. So these are quality visits that don't require the patient to commute to your office, but also doesn't require you to have an unlimited number of office exam rooms to accommodate people. So it's still by schedule in general, but again, it's something that can be done at the convenience of you as well as the patient. We shouldn't forget the behavioral health of telehealth. There's a growing use of telehealth in behavioral medicine, especially now because of COVID. There's an increased number of suicides, increased depression, certainly increased anxiety associated with this disease. Excuse me. So there are a couple of questions you need to ask the vendor. Now, a lot of this information is derived from the AMA and other medical societies. So, but you want to know, how does it get priced? Are you paying by the encounter? Every time you do a telemedicine visit, you got to give them $1, or is it a fixed monthly cost? This lets you figure out if it works for you from a financial point of view. Is there something called a virtual waiting room? Well, just as most of us have waiting rooms in our offices, you would have a virtual place where it would give the patient an opportunity to do a pre-visit screen and to answer a bunch of questions. And then you would see on this dashboard on your computer who came in and when, and then your staff could start triaging people that way in a virtual way. Do you have the opportunity to collaborate? Collaboration is super important, again, in a patient-centered medical model. Just imagine Mrs. Jones comes in, there's a rash, you take a picture of it, send it securely to your favorite dermatologist. Your dermatologist, in this case, it's not asynchronous, but synchronous, evaluates it and maybe gives you an answer right there and then. So that's an opportunity to collaborate. You might also collaborate from a behavioral health point of view. You're an internist, family medicine person, but you'd like to have a psychiatrist or maybe a psychologist or social worker pitch in on the evaluation and management of this patient. And then as someone who is also board certified in geriatrics, it's very, very important to engage family members when possible. And again, this is something you can do without having to fill up your exam room with many family members and deal with social distancing issues. You could do it again in this virtual space. You want access to a sandbox. A sandbox is a nice place for you to play with the software. And it wouldn't just be the physicians, it would be their mid-level providers, their medical assistants, and especially their billing people. You want everyone to feel relatively comfortable with using this platform and to raise issues for you to discuss with the vendor. For those of you who practice in neighborhoods where there are multiple languages spoken, it may be important for you to have access to a live interpreter. So you want to see, does that interact with the telehealth platform, or do you have to run it separately? You want to know about transcription. Many of us now just transcribe our visits and sometimes do it right there in front of the patient. Does that happen within the telemedicine platform, or do you have to do it with your EHR, or is there something that you have to do separately, like a Dragon-based software, and then import it into the telemedicine visit? Whenever possible, you want to access the experience of other members in your medical society and perhaps other medical societies. You want to talk to people who are in practices that are roughly the same size of yours, because a 2-physician practice has got different needs than a 100-physician practice. Something else that's very important, again, is this exchange of information. In the pre-visit evaluation of the patient, that patient might be answering a bunch of questions for you. What medications they're on, what their allergies are, who their doctors are, et cetera, et cetera, et cetera. Can you import that into your electronic health record, or do you have to copy and paste it somehow or re-enter it? Whatever can be transmitted seamlessly and electronically is an advantage for you, and certainly an advantage for the patient. If you can't take that whole telehealth visit and drop it into your EHR electronically, you might have to do it in a little bit more of a clunky fashion, which would be to print it and then scan it into your EHR. The goal, at least from several professionals I've spoken to, is to have a single silo of information. You don't want to have multiple silos. Your EHR, a different patient portal, a telehealth portal. You want to consolidate that information as much as possible so that it's easier to access. What happens if you decide that you don't want to renew the telehealth software and you haven't had a chance to move all that information into your EHR? Do you have the option of just reading it? So in that case, for a small fee, you can't do additional visits, you can't bill for additional visits, but at least you can see what happened in the past. Something that's becoming, again, more avant-garde and more important is the ability to plug into your health information exchange. That's what an HIE is. And what the HIE would let you do is perhaps get information on other physicians that the patient had just recently seen, or what their medications were, or whether they were just recently discharged from the hospital. This could obviously impact severely your management of the patient. Sorry. I apologize if I'm speaking too softly. Something called biometric devices and being plugged into the system. So for those of you that are managing patients remotely, can you get the information from a blood pressure machine, a scale, or a pulse oximeter directly sent to you electronically, or do you have to have the patient hand enter this information? Obviously, whatever can be done electronically is better for you and less of a stress factor for the patient. And we'll have some more questions at the end of this presentation. So in terms of workflow, again, if you've got a virtual waiting room where you could put the patient, that's an opportunity for the patient to be sharing their chief complaint, their vitals. You would expect them to take at least their temperature, but many of the patients now have their own blood pressure devices, which of course would also give them a pulse. It gives an opportunity for your staff to triage. Someone may have said that they had a bellyache, but based on a little bit of triaging, it might be a little bit more severe than you originally thought, and you might want to see that patient sooner. You might want to fire up the interpreter service if that's what you need, if you don't speak the primary language, engaging that caregiver, perhaps before you even speak to the patient, if it's a child of a geriatric patient and you want to get some background before the three of you start speaking. Documentation, whether it's done on one screen or two screens. You want to be able to generate prescriptions, ideally from within the telehealth platform, if possible. And you may also want to be able to send out referrals for imaging studies or specialists. It's always good to be able to share patient education materials. Obviously, they would be shared electronically, and there are many resources available, not the least of which is Medline. And again, you would have your billing person look at how the billing is done, because that's going to be the second to last thing. And then lastly is arranging for follow-up with this patient. I mentioned previously this concept of patient portals, which were actually freestanding in the past, and some people had patient portals and didn't even have electronic health records. Now they're usually combined. And the great thing about patient portals is that it really does cater to the newer generation of patient who really does not expect to get on the phone to do stuff, but expects to do as much as possible off their cell phone, tablet, or computer. So they can do anything from make the appointments, requests for medication refills, request referrals to others. And the wonderful thing about this patient portal is that because it's all being done electronically, it makes your office staff more efficient. A request for an appointment by phone could take anywhere from 3 to 7 minutes, perhaps. But if you do it electronically, you could probably process that in less than 15 seconds. Again, for medication renewals, same thing. That again could be a 7 to 10 minute conversation with your staff or an electronic transaction that can go quickly. It also gives the patients an opportunity to review their records if they're posted. There's something called CCM, chronic care management. Again, the quality of the interaction with the patient cannot be underestimated. So what you can do with a patient portal is send out reminders to your patients. You could also do this through your electronic health record, reminding them to go for mammograms, colonoscopies, immunizations. You could have different so-called campaigns. Right now, a good campaign would be to get your COVID vaccination. It's also important to get COVID testing, but that's something that we would have done maybe in the first 8 months, 12 months of the pandemic because we didn't have the vaccine. Now you may wind up doing both. It's super important not to make any major purchases in your practice without your staff involved. Now, obviously, there are decision makers in your practice that you want to talk to, but you also want to get some understanding about the frontline people and how they interact. So if you're going to have medical assistants working with the telehealth platform, you want to have a sense that they feel comfortable with it. Because if they're comfortable with the software, they will be able to make the patients more comfortable. So again, increased staff satisfaction makes for happier patients, which can make for happier docs. In terms of how do you enroll the patients? Well, we put up flyers in the waiting room. We got flyers in the exam rooms. The key thing is you want as much opportunity for the patient to see what you're offering. We even had, when we had our patient portal promotion, all the staff members wore a button that said, "Ask me about my patient portal." We have kiosks. So our kiosks are in the exam room, but you might have them in the waiting room. And a kiosk is just a tablet that gives the patient an opportunity to be engaged with the system. So they might look up some information before talking to you. And obviously, if you have your own website, you should be promoting the fact that you have telemedicine on your site. We did a survey recently with the population that I'm engaged with here on Staten Island, and many patients who were concerned about going to the doctor's office didn't know that the doctors provided telehealth services. So they didn't get the services that they needed. And so we helped many practices notify their patient population of the fact that they provided telehealth services. Again, that's something you can do through your EHR or through a third party. So you want to remind the patients that, especially until we have herd immunity, people are going to be a little concerned about being in a waiting room. Telehealth means timely appointments, shorter waits, not having to worry about getting a babysitter or parking. Again, most of the mundane activities, medication refills, that can be done through the telehealth portal. And something that's important to remember is that people might sign up for portals and so on, use it for a little while, and then drop off. And that requires additional reminders to patients. That's just something like anything else that sometimes you just need to be reminded to use a good service. Talk about millennials here. The idea is that millennials in general live off their cell phones. I've got two young sons in their 20s, and they do everything through their cell phones. So I have to understand that that's where they're coming from, and I want to give them that opportunity. But you also have to understand that there are patients who maybe are hearing impaired, visually impaired, and they may not be into this telehealth stuff. They might not have access to broadband. They may not have access to a phone with a screen other than the flip phone that they got for free. So you need to make allowances for those people. Again, that would be more of an audio conversation, but you might want to just bring them into the office if possible. If possible, try to do a lot of prep with the patients in advance. So when you're sharing information on your website, you should let the patients know that they're going to need broadband to communicate with you. They're going to need a screen of some sort to interact with you, otherwise it's going to be an audio type visit. They can do that dry run that I mentioned on the screen with your staff member before doing it with you. The dry run would be just the interaction piece. So again, it makes your time with them more efficient. You're not getting hung up in the Zoom call hang-ups where people have mouse faces or cat faces during the interaction. It's important on your side to have enough illumination. So I've got behind my laptop with the camera a light that's flashing on me, as well as some background light. So your patients need to be able to see your face. It's very important. We give a lot of cues visually as well as verbally, and it's important for them to be able to see you. And like anything else, you should do a teach back opportunity for them so they can tell you that they understood what the recommendations were. And always try and give them time for questions, because if they walk away with their questions without sharing with you, that tends to lead to the problems. Again, we spoke about seniors maybe being hearing impaired or visually impaired. So you have to understand that they may not be the best patients for this. But again, in an engaged sort of family, you could potentially have the son or daughter or niece or nephew, if they're authorized, to be part of this telehealth visit. So don't pass that up. I do think that there's a lot of value in having the family be a major team player. And it certainly made my practice more successful when I had family members involved. Just as a reminder, we're working with MILMIC as well as your medical society, and we have to talk about liability. And so just as a reminder, the telemedicine visit should be done on an encrypted platform. During the height of COVID, it was the wild, wild west, quite frankly. Any means was acceptable. But it's important to realize that HIPAA compliant encrypted means of performing telehealth visits are available, and for the most part, very affordable. This goes back to one of the first things you need to ask your vendor is, how is the pricing? So if $1 a visit seems reasonable to you, then you can have a secure platform for $1. If it's $30 a month, then you just need to see how many visits it would take to meet that, if you think it's a platform that makes sense for you. Another thing that's really important is that when you're doing stuff through a telemedicine platform, as opposed to just picking up the phone and answering questions, is that there's a certain amount of text information that's being exchanged. Your notes and so on are being built into this telehealth visit. That patient's contribution from the virtual waiting room, the vital signs, the chief complaint are being built into the note. That's going to be available to you in case there's a negative outcome and there's an allegation that a person told you something and it wasn't addressed. Well, if it's in the telehealth visit and hasn't been documented, then you could say, quite frankly, that it wasn't mentioned. And I can tell you that what we've done with our visits from the very beginning, because we've had electronic health records for over a decade, is we always gave the patient a copy of the visit. And a lot of this can be posted now electronically in a portal. So again, it makes it easier for the patient and their significant others to know whether something was really addressed at that visit or not. And give them the opportunity, quite frankly, to contact you for a follow-up if it needed to be addressed and they just forgot. One of the things that COVID has cast a very bright and burning light upon is the disparities between different communities, and especially in communities of color. And this disease, as you know, is twice as fatal in certain communities than others. So what we need to do is look at what are the barriers, and this is where the social determinants of health come in, SDOH. In the United States, we tend to focus more on hard medicine, the pills, the injections, the surgeries. And we have, until recently, not spent much time on the social determinants of health, which, if you look at the studies, impact health outcomes 80% compared to what we do as physicians. So for all our training, for everything we do, trust me, it's only 20%. Why? Why is it only 20%? Because if I don't have a place to live, I'm not going to necessarily be able to get a phone call from you to follow up. If I don't have a place to live, I don't have a place for you to send me a reminder to come in for a visit or get my medications. If I don't have any food, obviously that's pretty obvious, right? But maybe I can't afford quality food. So how is that going to help me manage my hypertension, my hyperlipidemia, my diabetes, congestive heart failure, transportation? That's actually nicely addressed by telemedicine. I may not have the opportunity, I may not own a car, but I could do a telehealth visit, assuming I have broadband. That's another disparity. There are many communities that don't have broadband. So not only do they have issues with housing and food and transportation, but they may not even be able to do a telemedicine visit with you. Number 4 was this concept of fear, people being afraid of, leaving their homes to go to a doctor's office. And lastly was the issue of not even be aware that a physician has a telemedicine capability. So this piece of legal text, I'm just a doctor, so Will is the real person for this stuff. But essentially what it said was that on March 6, 2020, Medicare loosened up the rules for us, and it made it much more easy, or much easier for patients to get access to the care that we could provide. And much of the cost sharing that normally would have been involved, the copays and so on, were being waived by most of the insurance companies. So the barriers were being removed to the patients so that they would access us. And that means we have to have the platforms to access them. And remember I spoke about HIPAA compliance. Again, there was a time when FaceTime and Skype could be used during a national emergency, but don't expect that to be the norm forever. This is a small grid just to show you that there are a whole bunch of codes, and we have this available at Milmic and other sites. Essentially what it says, you can have a visit where you're just following up with a patient. It's a virtual visit, 5 to 10 minutes. How's the patient doing on an established patient? You can have an e-visit, which is a little bit more engaging, and they go from levels 1 to 3. And then you've got the telehealth visits where perhaps they're more of an urgent care type visit, like I listed before. It could be a mild UTI or a mild upper respiratory infection. Something that you should know when I was talking about biometric devices, there are relatively affordable pieces of equipment out there that would even let you auscultate a person's lungs. So depending on if you're providing care in a community home setting, they could potentially have a kit, which would be like an office clinic in a box that would let you look at someone's eyes, ears, throat, and listen to their heart and lungs. So there's a lot of technology out there depending on the situation. If you're doing nursing home work, this is an opportunity for you to follow up on your patients, perhaps without having to go in as frequently, but still have access to them. And in many ways, you're almost as effective 8 miles away as you are 8 inches away from the patient, because you're going to be able to see them as well as hear them, and then use the nursing staff to help you out. Just bear in mind that just as we have issues when we're trying to get on these Zoom calls, if a patient could forget their login, they forget their passwords, they may not be proficient in English and technology, so have a fallback plan. You may just have to say, okay, Mr. Volpe had a telemedicine visit at 6 p.m. He's not in the virtual waiting room. Just have one of your staff members call him up on the phone and see what's going on. So throw them that lifeline. That's very important. And I believe at this point, Mr. William Hassett will now have control of the screen.
Okay, thank you very much, Doctor. Good evening, ladies and gentlemen. I'm going to build upon what Dr. Volpe was discussing with telehealth and its expansion, and talk briefly about some of the risks associated with that in the sense of cyber risks that are presented. The COVID-19 pandemic has really catapulted telehealth to the forefront of healthcare. As Dr. Volpe alluded to, there's been relaxed state and federal regulations concerning privacy and billing. And it's been a very valuable tool that allows practitioners to treat their patients without exposing them to the virus. Studies have shown that in 2020, nearly 80% of physicians were utilizing telehealth. That's in comparison to 22% in 2019. So it really has found its niche finally. It's been around for many years, was not utilized, and now it has grown substantially. Whether it will continue to expand, I think, is going to be driven by state regulation, federal regulation, and a lot of it's going to be dependent upon reimbursement. A few weeks back, Governor Cuomo came out with his executive budget for fiscal year 2022, and that included comprehensive telehealth reform. It was very robust in his what he wants to achieve. This includes expanding the definition of the originating site. The originating site is where the patient is located. So there were some restrictions pertaining to where they had to be. They had to be in their residence. They had to be at a clinic. And under the new definition, it'll be anywhere the patient is located. So it really expands where they can be at the time of the services. It's a little vague, but it's his plan wants to expand and promote interoperability between the various platforms, whether it be electronic health records and the telehealth platforms, or the interworkings of telehealth between separate health systems. Also, and this is an important one, is the expansion of licensure reciprocity with bordering and northeastern states. The governor wants to develop compacts with the bordering states and other states in the northeast regions where they would recognize the license of New York doctors and vice versa. Also, they want to implement requirements concerning the providers offering telehealth. They want to make sure that that's disclosed. As Dr. Volpe was alluding to, many patients weren't unaware that their physicians were providing this service. So these new regulations would require that that is disclosed. And finally, requirements pertaining to the expansion of the networks, health plan networks, to adequately meet the needs of their insured. So it's a very ambitious plan. Whether this will stick or not is subject to debate, which is probably ongoing right now in the legislature. There's a lot of issues here, though, to be cognizant of, and Misny has raised many of them. I think a lot of this is going to be cost-driven. Whether telehealth is a one-trick pony in the time of a pandemic, or if it's something that can really continue to grow, is going to be dependent upon parity of reimbursement for providers. Patients want to see their doctors, but at the same time, this is very convenient, and it's convenient for the doctors. But at the end of the day, reimbursement, I think, will have a lot to do with it. So It'll be interesting to see how much of this will get passed and how we will proceed in the future with the use of telehealth. But moving on to the main focus of my discussion tonight, healthcare as a cyber attack target, and in the context, how that affects telehealth. Healthcare has been a longtime favorite of cyber attackers. Since 2010, healthcare records of over 150 Americans have been compromised as a result of breaches and cyber attacks. An electronic health record is really a treasure trove of information. It has personal information, medical information, and of course, financial data. So this is 50 times more valuable to a cyber criminal than, say, a stolen credit card, which can also be identified rather quickly once your credit card is stolen. These items that are contained in your health record could take you a long time to realize that your identity has been stolen. So now we're presented with the rapid expansion of telehealth. And this is going to provide another avenue for cyber criminals to gain access to this information. As health systems and practitioners expand their digital footprint, they're also expanding or increasing the attack surface for these cyber criminals to gain access to this very valuable information. So let's just talk briefly about what are cyber attacks. In simple terms, it's an attack from one computer against another, or an attack from one system against another network of computers. And the goals of cyber attacks are rather simple. One is to disable or knock the other system offline, or to gain access or administrative privileges on that other system so you can get access to the data that they contain. There are numerous mechanisms that can be utilized by cyber attackers. Malware, which is malicious software, which is basically downloaded on the target computer and then commits to theft of data. Phishing emails. These are very prominent now in use by cyber attackers. These are emails that are very carefully and deceptively crafted to appear that they're your bank or your credit card, but it's not. But it lulls you in. You provide information such as your password, and then they're able to gain access to your system. There are other mechanisms that they're also using, such as denial of service attacks, which is basically where they overwhelm the web server with bogus practice to bring it down. So these are some of the mechanisms that they're using in their attacks. Probably the most prevalent form of cyber attack we're seeing right now is ransomware. Ransomware is something that's deployed by phishing messages, malware, and it allows the hacker to gain access to your system, to remove or encrypt data that's on your system, and then demand payment for return of the encrypted data. There's no guarantee the hacker is going to return the information either. So it can be very problematic if you suffer an attack based upon ransomware. Studies have shown that this is really one of the fastest growing crimes in America. The FBI has stated that over 100,000 computers a day are subject to ransomware attacks, and ransomware payments are approaching $1 billion annually. One of the reasons for this is the use of Bitcoin and virtual currency. It made it very easy for these cyber attackers to get paid for what they're doing and continue with their anonymity. And these attacks are wide ranging and they're indiscriminate. They can be for a few $100 to squeeze money out of a small business, or they can be large attacks on systems. I've been contacted by doctors' offices who've said, look, my computer's not working, and there's a message on there saying that, if I don't pay money, they're gonna release these records publicly or steal my records. So it can happen to a small practice as just as well as a large health system or hospital. Healthcare providers are unique in these attacks, however, and they are subject to, they're rather vulnerable, more so than other large entities and corporations. This quote from the U.S. News World and Report a couple of years back really sums it up. When it comes to data protection, big technology companies are the warships, and hospitals are small rubber dinghies in a sea of hacker sharks. Is it a perfect storm for vulnerability? Right now we're presented with the expansion of telehealth, and we have relaxed regulation. There's not requirements for encryption right now. There's not requirements for business associates agreements. You could be using FaceTime to conduct your telehealth visits during the pandemic. So we have that laxed regulation of what's going on. Also, telehealth was rolled out very quickly, whether it be for large organizations or small practices. Almost overnight, physicians transition to the use of telehealth. So that again creates an avenue for weakness. And again, the security for whether it be an electronic health record or telehealth, it's really counterintuitive to what you're trying to achieve. The goals of these platforms is to share information. So again, security is trying to protect it, but meanwhile, the whole goal is you want to share the information with the patient or with the other provider. So now that we have an idea about cyber attacks and the risks presented to telehealth, why don't we talk a bit about Hipaa security and how that applies to cybersecurity in healthcare and telehealth. Hipaa regulations require covered entities, that's a healthcare provider, to develop and follow procedures that are going to protect PHI, which is protected health information. Protected health information is anything that's transferred, received, or handled electronically in the context of your providing care. Hipaa has regulations which pertain to privacy, security, and enforcement that must be followed by all covered entities. And again, this applies to all forms of protected health information, whether it be paper, oral, or electronic. So again, any communications you're having over telehealth platforms, this is all protected under Hipaa regulations. I'm going to spend some time talking about the security rule, which is probably the most prevalent and important concerning the protection of information on telehealth platforms. The security rule is a subpart of the regulations, and it requires covered entities to implement safeguards to protect the confidentiality and the integrity, as well as the availability of the protected health information. Again, this standard, it's always important to keep in mind, is you have to have reasonable and appropriate safeguards in place to ensure the confidentiality of the information and ensure that it's protected. So it's not a very rigid requirement. There's flexibility in place that allows a provider or a practice to implement what would be appropriate concerning their particular platforms or usage of telehealth or electronic health records or anything else that they're using electronically for the transmission of data. Reasonable and appropriate, it allows you to analyze your needs and implement what is appropriate. So when you're doing so, practices should really consider the size, the complexity, and the capabilities of what they're implementing. Also, you want to take a look at your infrastructure. What is your hardware that you have and your software, the technical aspects of it. So again, it's going to require a lot of input from your information technology, whether it be subcontractors, staff that you may have in your practice. And of course, this is going to be a cost component to all this. The cost of security measures could be expensive, so you have to keep in mind what is appropriate for your practice, as well as what is the likelihood of there being a breach. If it's a minimal risk, again, then it's something you would probably not need to go overboard on. Whereas if you are using these platforms extensively in your practice, you should make sure that you have the appropriate protections in place. The security rule of the Hipaa regulations is really comprised of three safeguards. It's broken down into administrative safeguards, physical safeguards, and technical safeguards. A covered entity is required to adopt reasonable and appropriate policies and procedures to comply with the provisions of the security rule. So that means you got to have written policies and procedures in place, and it also requires the covered entity to periodically review their policies and procedures to make sure that they are in accordance with the technology that's being used. If you think back, even as recent as 5 years ago, I'm sure that you most likely were not using telehealth, if at all, certainly not as extensively as practices are now. So as you evolve and you change in the technology that you're using, you want to make sure that your policies and procedures that you have in place are current with the technology that you are going to be utilizing. How does telehealth impacted by the security rule? Let's talk about that briefly. So let's talk about the first component, which is the administrative safeguards. Hipaa requires that you have policies and procedures in place to prevent, detect, contain, and correct security violations. So if we're talking about administrative policies in the context of telehealth, some of this is probably common sense, but it bears repeating. And that is, you want to make sure that you have strong password security on all your telehealth platforms, okay? I mean, I can just tell you on my computer, my IT department requires me to have a password. I think it's like 20 characters long and have different, letters, numbers, the whole bit. So, and there's a reason for that. It makes it highly unlikely that someone else will be able to access that information. So you want to make sure that you have the same type of protocols in place on your telehealth platforms. Review and update your existing employee and staff policies to account for the risks associated with telehealth. If you're utilizing telehealth in your practice, you want to make sure that your other staff members are aware of what type of risks could be presented, what's appropriate use of the platform moving forward. So you want to make sure you review the existing policies you have relative to your employees. And finally, an incident response and remediation. If there is a breach, what does your policy have in place concerning notification of patients, as well as possible authorities if there's a breach of unsecured protected information? There are requirements when you reach a certain level that you have to notify the authorities concerning the breach of this information. Business associate agreements with your telehealth platform provider. Again, right now, this is not a requirement. You're not required to have a business associate agreement in place with the telehealth platform you're using. But there's going to come a time, and hopefully it's sooner than later, as we come out of this pandemic, that the government's going to reinforce their requirements for business associates agreements. So many of these platforms, such as if you're using FaceTime, you're not going to be able to get that. So you want to make sure that when you are using the telehealth platform after this pandemic is over, that you have a business associate agreement in place. A business associate agreement basically is going to hold that vendor to the same security standards and privacy standards that you are required to be held to under Hipaa. Also, the business associate agreement is going to limit the vendor's authorized use of public health of the health information. You want to make sure that there's limitations in place as to whether they're maintaining it, and also, at the end of your agreement with the vendor, what happens to that information? You want to make sure that it's destroyed and that they're not going to continue maintaining it after the fact. The second component is, again, physical safeguards. Hipaa requires a practice to implement policies and procedures to limit the physical access to electronic information systems. So again, a lot of this is common sense, but you want to make sure that the platform or the devices you're using are locked and are only accessible with passwords. If your staff is utilizing laptops and they're accessing telehealth platforms from home, you want to make sure that they're leaving the office with these devices, or even if you're using desktops, you want to ensure that the USB ports are disabled. That's a prime source for malware and ransomware attacks. It is somebody putting something into a drive, loading it to the system, and then they gain access to the protected information. Obviously, you want to make sure your facility is physically locked and to prevent the access to inappropriate individuals. Locks on the doors. Not only the key locks, but the swipe locks. You want to make sure that everything is in accordance and protected. You don't want anyone getting in there to access these materials. Do you have the ability to scrub a device if it's lost or stolen? On my you can't see it on the background. Look at that. But on my iPhone, I have a lot of protected information, attorney-client privilege, documents, medical records. But I know if I ever lose my device, my IT department has the ability to scrub it remotely, so no one will ever get access to what I have on there. And one last thing about physical safeguards is the telehealth encounter should be done just like a face-to-face examination. You want to make sure that you're doing it in a secure location. You want to make sure that the patient's in a secure location. You want to make sure that no one's present in the vicinity of you when you're having these encounters that shouldn't be. For that matter, if you're counseling, if you're interacting with a patient and you need to have a chaperone present, you should do that. Make sure you have someone available that's present for the encounter. Make sure that you're documenting accordingly that person is present, and obviously advising the patient that there's someone else present from your staff for the encounter. Lastly is the technical safeguard component of the security rule. And this requires that policies and procedures are in place to ensure that there's access controls, audit controls, system integrity, and finally transmission safety. This is really the IT component of everything, which probably Dr. Volpe would be more versed at than me at the end of the day. But you want to ensure that your platform and your vendor that you're using is HIPAA compliant. You want to make sure that they are regularly performing software upgrades on their telehealth platforms and that you're doing so in your office. You want to make sure that you're having these communications over a protected network. So there's end-to-end encryption that's really going to minimize the risk that a breach occurs or that there's an inappropriate disclosure. And if you're integrating a telehealth platform with your electronic health record, you want to make sure that they're obviously compatible, but you also want to make sure that you're not creating another avenue for a cyber attacker to gain access. So again, when you're implementing these programs, you want to make sure that the vendor is aware of this and make sure that you're not opening a door that allows a cyber attacker to gain access to the electronic health record. There are also some other components of telehealth security that I'll talk about that are really not HIPAA related, and that starts with the patient. There's risks associated with the patient because, again, they're not subject to the HIPAA security rule. So you want to make sure when you're engaging patients on telehealth that they're aware of the risks stemming from the devices that they're using and that there's always a potential for a breach to occur. You want to make sure that you obtain their consent prior to engaging in telehealth. And again, you don't need to have a written consent, but it would be best practice to advise them, look, we're using telehealth, advise them of the risks associated with that, potential for, obviously a need for in-person examination, should it come to that point where you need a hands-on exam, but also be aware of the risks associated with data breach, such as their device, if you're not using a secured network. And obviously, from a physical component, you want to make sure that the patient is also in a secure location. They should, again, it should be taking place the same way it is in the examination room. So they should be in a secure location where no one else can overhear what they're discussing or gain access to any information. I'd like to talk briefly about the importance of scrutinizing telehealth platform vendor agreements. These agreements are, there's a lot that goes into these, so you want to make sure when you are choosing a platform that you look very carefully at what assistance they will provide to you in the event of a breach. Also, is there any indemnity for a breach or attack that's caused by their services? Also, are there any limitations on what a vendor's liability is in the agreement? And finally, you want to make sure that you have proof of the vendor's liability insurance. You want to make sure that you have documentation demonstrating that they are appropriately insured. There was a recent case from the federal court in Virginia, West Virginia, earlier, actually last year. And it was very interesting. I won't go into great detail, but it really highlights the need to scrutinize these agreements. Briefly, it was a hospital that hired a IT entity to provide dictation services. They didn't put an appropriate patch on the network. There was a cyber attack, and the hospital suffered, I think it was $11 million in damages. They lost access to their records. They had to hire outside contractors to come in to gain access to it. So they sued the vendor for whatever was not covered by their insurance, which was roughly $6 million. And the vendor moved to dismiss the case based upon their agreement that they had. Part of the agreement said that they weren't responsible for any damages unless they were intentional or criminal. And they also had a provision in there saying that the damages, if they were subject to damages, it was limited basically to the cost of the agreement. So I'm sure that the agreement was a fraction of the damages sustained by the hospital. And ultimately, the motion to dismiss was denied and the case is ongoing. But it really shows the importance of that you need to look at these agreements carefully to see what the indemnity provisions say and what protections you're going to get from the vendor in the event of a breach. Sticking with that point, the importance of cyber liability insurance. Electronic protected health information breaches may not be covered under your professional, your general liability insurance. So you may need cyber coverage depending on how much you are using these platforms. It's really, you're gonna have to perform a risk assessment to determine if it's necessary or not. But things to consider is what support does the policy provide for you in the event of an attack? Is there any coverage for civil regulatory fines or penalties under the contract? And finally, what coverage do you have? What are they going to provide for you in the sense of post-event mitigation costs? Again, as I was talking about with the hospital, they had to spend an exorbitant amount of money on vendors to rebuild their system essentially. So again, these are very costly. So it's something you want to take into consideration if you are considering a cyber liability insurance policy. You know what protections you have. So I'll conclude with just saying that telehealth has really been catapulted to the forefront during the pandemic. It has really shined a light on its capabilities. It's important as it expands that practitioners keep in mind the risks associated with privacy breaches and cyber crimes. And an easy way to mitigate that is really to make sure that your HIPAA policies that you have in place are up to date and account for telehealth, because that will certainly minimize the risks associated with a telehealth related breach. Thank you very much, and I guess I'll turn it over to Matt if there's any questions. Matt and Elizabeth.
All right, thank you, Will and Dr. Volpe. That was very interesting, very insightful. We do have a couple of questions here. If you do have a question, you can enter it into the Q&A feature. But I would say the first question we have here looks like it would go to Dr. Volpe. Excuse me. You had mentioned encryption. When it comes to encryption, what level should a provider be looking for when deciding upon a telehealth application?
I pretty much can say that the standard right now is something called 256 AES. So if your vendor provides 256-bit advanced encryption standard, then that's pretty much what anyone would be going for. Anything above and beyond that's probably military grade. So 256 AES, that's what they should be providing for you.
Okay, thank you. And this question is with respect to informed consent. So I'm going to say that this one's going to go to Will. What is the best way to obtain and document informed consent for a telehealth visit? Is it something that should be done in advance? Is it something that you do verbally during the encounter? Basically, what's the recommendation?
There are a number of ways you can obtain consent. There's no requirement for a written consent, prior to using telehealth. It's something that could simply be done prior to the encounter with the patient, at that first encounter, explaining to them briefly the risks associated with it and what their obligations are. And then you could document your record that you had the conversation and that the patient, assuming they consent to moving forward, has done so. Although it's not required, my office for Millennials Insurance, we have developed a consent document that you can utilize if you have, you can have patients sign that in advance, or if you can transmit it electronically. So you have that in your record. Again, it's not required, but it's something we have developed. So if you feel more comfortable using that, we have that. Also, it provides a very easy way of having an outline of what you should be discussing or could be discussing with the patient prior to obtaining their consent to moving forward.
Okay, thank you, Will. And one more question popped in about EHRs and telehealth. Dr. Volpe, can electronic health records provide telehealth visits?
Matt, there are quite a few electronic health records systems that are out there now that offer telehealth as sort of like a plug and play module. So the advantage of doing it from within that electronic health record is that you don't have to figure out how to transfer information, allergies, medication lists from your EHR to the telemedicine platform, or getting the results from the telemedicine visit back into your EHR. So, and the other thing is it's all on one screen. So as you're looking at the medical records, you have a little pop-up video of your patient. And so you're looking at everything in windows, so to speak. That notwithstanding, if your electronic health record does not provide a telehealth platform that is easy for you to use, then it makes sense to go for an independent, freestanding platform.
All right, very good. That looks like it's the last question. Elizabeth?
Okay, I'd like to again thank the Nassau County Medical Society for bringing this presentation to you this evening. At this time, the webinar is over, and thank you for joining us.